Do you ever feel tingling or numbness in your hands and feet? This sensation is one of the main symptoms of vitamin B12 deficiency. You might also experience fatigue, weakness, pale skin, and mood changes, all of which can be linked to low vitamin B12 levels. Vitamin B12, also known as cobalamin, is an essential nutrient that plays a crucial role in the body. It serves as a coenzyme in the synthesis of myelin, the protective shells around nerves. This function is crucial because myelin integrity directly affects the neurotransmitter production and overall nerve function. Given its importance, it's no surprise that vitamin B12 deficiency is associated with various neuropsychiatric disorders. Serum cobalamin levels are generally a sensitive marker of B12 deficiency. In fact, 95% of patients with low B12 levels shows elevated serum methylmalonic acid (MMA) or total homocysteine levels. But why does this happen? Vitamin B12 acts as a cofactor for two key enzymes, methionine synthase, which play a role in DNA synthesis and neurotransmitter regulation, methylmalonic CoA mutase, which is essential for fatty acid metabolism and myelin production. When B12 is deficient, these enzymes cannot function properly, leading to a buildup of methylmalonic acid and homocysteine, both of which can contribute to neurological damage and cardiovascular risk. The most accurate way to check B12 deficiency is checking these two byproducts instead of vitamin B12 only, because cobalamin is not sensitive to certain types of measurement. Homocysteine is an amino acid and a natural byproduct of protein metabolism. It is temporarily produced as an intermediate metabolite when the body breaks down methionine, an essential amino acid. Under normal conditions, homocysteine is quickly converted into other compounds and does not accumulate in the body. Ideally, its level should remain below 15 micromole. However, when vitamin B12 levels are low, homocysteine metabolism is disrupted, causing its levels to rise above the normal range. This condition, high homocysteine, can have serious health consequences. One of the most concerning effects of elevated homocysteine is its impact on the heart and blood vessels. High homocysteine levels can damage blood vessels and trigger inflammation, increasing the risk of atherosclerosis, blood clot, heart disease, and stroke. Impaired blood vessels may lead to high blood pressure too. One of the most severe consequences of vitamin B12 deficiency is neurological damage. High levels of homocysteine and methylmalonic acid (MMA) contribute to oxidative stress, which can lead to memory loss, cognitive decline, depression, anxiety, Alzheimer's, and dementia. Vitamin B12 play a crucial role in nerve protection. When B12 levels are low, the myelin shells that surround and insulate the nerve cells begins to deteriorate, a process known as demyelination. As this occurs, nerve fibers become damaged, leading to symptoms such as numbness, tingling, and muscle weakness. Elevated MMA levels are a direct indicator of B12 deficiency. If left untreated, peripheral neuropathy can develop, and nerve damage may become irreversible over time. Cognitive functions continue to decline, resulting in memory loss, brain fog, and mood disorders such as depression and anxiety. Megaloblastic anemia is a serious condition often caused by vitamin B12 deficiency, leading to impaired red blood cell production. Cobalamin, vitamin B12 is essential for DNA replication in bone marrow cells. Without it, cell division is disrupted, resulting in the formation of large and immature RBCs, known as megaloblasts. These abnormal red blood cells are dysfunctional and unable to carry oxygen efficiently, causing symptoms similar to anemia. As a result, the body experiences reduced oxygen delivery, leading to fatigue and weakness. Ineffective RBC production and breakdown can also cause pale skin or jaundice. Fortunately, most of these symptoms can be easily managed by improving dietary habits. Vitamin B12 cobalamin deficiency is closely linked to diet. Since B12 is mainly found in animal-based foods such as meat, fish, eggs, and dairy, people who do not consume these foods regularly are at a higher risk of deficiency. Organ meats, particularly liver, are rich in B12, but vegetarian and strict vegans are most likely to develop a deficiency because plant-based foods naturally lack B12 vitamins. Additionally, a diet high in processed food can also contribute to the problems, as these foods are often stripped of essential nutrients, including B12. If getting enough B12 from food is challenging, taking supplements or consuming fortified food is a great way to ensure adequate intake.